Well, it looks like the government's vaccination rollout is picking up speed, especially with the announcement that 35 to 49-year-olds will be getting their vaccinations from the 1st of August. Heidi Giokos has been closely following this morning's briefing, and she's going to help us fill in some of the details. Heidi, great news that another age group can be vaccinated. Any other frontline workers, frontline staff, such as journalists, who are next on the list?
I think it's fantastic news, Annika, that those between 35 and 49 years old are able to register as of the 15th of July, and they will start getting vaccinated from the 1st of August. There's clearly a high demand for many people to want to get vaccinated. But we do understand that from the Department of Health, Dr. Nicholas Crisp saying that it's very difficult to prioritize certain groups and certain categories that don't fall within a certain cohort or age group that the government has decided to open up vaccinations to. It's a lot difficult to roll out and to manage. There have been many questions about why those that have comorbidities that don't fall under the category 60 and above, 50 and above, and now between 35 and 49 above, why they have not been considered to get the vaccine. But we do know that special requests are being submitted to the Department of Health. But as I mentioned, the department saying it's a lot difficult to manage special requests and groups, and this is why they're going according to age category, because once you go according to age category, the older you are, the more likely you are to possibly have a comorbidity and be in a vulnerable group. This is why they've decided to go according to the age category. I'm not entirely sure when journalists or other key essential workers that contribute to the economy, even restaurant owners, waitresses and waiters who constantly are told that their sectors of the economy will shut down when there's a third wave or a spike in infections, when they will be vaccinated, because they are also exposed. They are also prone to be carrying the virus to exposed and vulnerable communities. So we do know that certain sectors are trying to manage that vaccine rollout. We know GCIS is trying to sort that out for journalists. So we'll just have to wait and see when that announcement comes through.
I know the National Prosecuting Authority is also asking for its prosecutors to get vaccinated. How many people are being vaccinated, to your knowledge, on a daily basis? There was quite a lot of criticism that things were going far too slowly.
I must say, Annika, in the last 2 to 3 days, we have seen a significant increase in the number of vaccines that have been administered. Yesterday, we had over 190 people vaccinated in one day. The day before, it was 180,000. So each day, it seems as though vaccines administered is increasing. We know over 4 million people have been vaccinated in total. And the health minister, the acting health minister, indicating that by August, they're hoping to administer 250,000 vaccines per day. The goal by the president is to have 300 vaccines administered. What's also key here is the arrival of more vaccines expected. We know currently we have stock for the next 18 days. Dr. Nicholas Crisp saying that this is the most we've ever had. It's the best position the country's ever been in terms of vaccines. We have about 3.8 million in the pipeline at the moment. So it seems as though things are going good. Vaccine rollout is expected to intensify and increase, especially over the weekends. So just holding thumbs that everything will go according to plan, because the option that we have right now is to vaccinate. It reduces the possibility of variants spreading and, of course, severe COVID-19, where we're seeing hospitalization and deaths in this current third wave.
Heidi, before I let you go, I did want to touch on what you picked up, which was weekends. People aren't getting vaccinated on weekends, and government said it was because there wasn't enough money to pay for overtime. Is that now being addressed?
Yes, we do know that according to the acting health minister, National Treasury, there was a meeting with National Treasury, and it's been concluded that medical graduates have now been placed, which of course is going to boost the support within the healthcare facilities, not only for the vaccine rollout, but overall support, especially in this third wave. So we do know that vaccine rollout on weekends is going to increase significantly. And also it's important to note, Annika, that the private sector has really been coming through, especially on weekends, with their private vaccination sites, working overtime to try and get as many vaccines over on the weekend, as many people can't get to vaccination sites in the week, especially the elderly who rely on the younger to get them to these sites. So hopefully we'll see those vaccine numbers over the weekends doubling, because right now we're seeing about 5,000 over the weekend, which isn't great.
Reporter Heidi Giokos, I'm going to start calling you our COVID correspondent. She was watching the acting health minister's latest briefing on the country's COVID-19 response. Thanks again.